in the process of the outbreak, and it is also where the contradictory lies. Luckily, the CPC Central Committee cares and supports a lot for the work in Hubei. General Secretary Xi Jinping, he himself, cares about the process about the logistic and material supply. With the support of the CPC Central Committee and also the guiding group and also the help from other different provinces and with our own efforts, currently, for the medical materials that supplied to Hubei province, the general circumstances improved, and the supplements about the daily necessities has also improved. With the progress of the disease, new problem occurred. The medical equipment for the severe cases has increased gradually, especially in different communities after the lockdown about the communities. The day-to-day necessity, its supplements and also its delivery is facing new challenges and questions. So my briefing is going to be two parts. The first part is about the medical materials and supplements. Generally speaking, medical materials devices has been improved in terms of the supplements, while the problem, the gap still stands out. The demand and supply grows rapidly. With a huge growth in the supply side, the demand also grows substantially. And I think this contradictory will be lost for a period of time. We have made a lot of progress in the supplements. The protective suits, for example, at the very beginning, we can only gather around less than 1 million units, and with several different borrowings from other brother cities. Currently, the total number for the self-production and also the borrowings, it can be reaching around 117, and for the medical mask, the daily supplements can be reaching over 300 million units. The procurement, logistic deliveries, and is improved greatly, and this is all due to the efforts, as mentioned. We want to thank the support from the CPC Central Committee, different ministries, and also brother provinces. I have a few numbers to brief you. To the 20th of the February, CPC Central Committee and other different provinces has donated around 1.93 million units about the protective suits, while 5.95 million units about the medical masks. And for the ICU protective suits, the total supplements is reaching 64,000. The second number I want to brief you is about the donations from all walks of life. Since the outbreak of this coronavirus, all the societies has donated us a lot of the medical materials and medical devices. And for ourselves, we have also been working really hard to get some of the progresses. Up to yesterday, in the province, we have been producing around 62,000 units of the protective suits, while the N95 medical masks is reaching 39 million units. And the fourth effort we have done is about the medical management and targeted delivery. We need to make sure that the good medical devices and equipment is going to be used as the medics who are fighting at the forefront of the outbreaks. We have a clear policy that other than the medical workers, the doctors and nurses, no single other people is allowed to wear these protective suits. With all of these methods, we believe that the improvements is substantial. And on the other hand, the demand for this is also growing very rapidly, with the growth of the confirmed cases and severe cases. The number is also increased quite dramatically. For example, in the 12th of the February, over one night, there is an increase of the 40,000 confirmed patients. Another part I want to mention is about in the recent few days, there's a lot of the medical teams, and also the PLA has sending their medical teams to Hubei to support our rescue work. And currently, there are around 38,000 medical workers helping in Hubei. And when they are arriving in Hubei, they bought their own protective suits and also the medical masks. But with the time progresses, their own supplements is worn out, and they need other different supplements. The third demand is increased not only from the medical workers, but also other different demand, including the disposals of the medical wastes, and also the funerary services, and also the public security workers who get the close contact with the patients. They also need our protective suits and giggles and professional masks. And the demand is also growing quite rapidly. So the conclusion is that the supplements, the supply is growing, and also the demand is growing, but the general circumstances is improved. And to tackle this demand, we are also going to increase our production capacity. And in recently, for the province, we have launched 3 first branch a campaign, and we actually required several different companies. For example, the textile company, if they can be transferred to the emergency production factories which can produce the protective suits, we will give them the green channel to help them to fast forward their production capacity. We have also newly built several different factories and invested in new project, which is going to help us to produce more medical equipment. Through these 3 methods, we hope that the general supplements could be better in the coming few days. This is my first part about the updates. The second part is about the rescue equipment, especially the rescue equipment for the severe patients. The demands and supply really stands out. And the contradictory lies. As we all know, Wuhan City has increased a lot cabin mobile hospital, and many different hospitals has transferred several different professional cells into the infectious disease cells prepared for the patients. With all of this transformation, the equipment is in a huge gap for the CT equipments and also the ventilation machines. The demand is growing quite rapidly. And for the huge demand in this professional equipment, it is a little bit different with the supplements about the protective suits and masks. Some of the equipments cannot be produced in Hubei province and cannot be produced even across the country. So I think under the leadership of the NDRC and MIIT, we have arranged several different medical equipment from across the country and even trying to buy it from across the world to try our best to meet the demand for these newly built hospitals. This is another question facing in front of us. Generally speaking, no matter for the supplements about the medical resources or the supplements about the medical vascular equipment, I think the general circumstances improves a lot. And we all know that for the Wuhan city, it is planned to build up more cabin mobile hospitals, so the procurement is going to be continued in the future. That is my introduction for the first part. And the second part is about our supplements to the daily necessities. Since we are adopting stricter measures in the community and a better management for the community, the guarantees about the daily necessity also means we are facing new challenges. To be frankly, a huge city like Wuhan, with its vast population, needs the management and needs all the business to change its original forms. And our habits of the purchasing needs to be shifted from the personal procurement to be staying at home. And that is how we are going to cut up the infectious ways. So from the way of our purchase, I actually advocate the online shopping, and we will help you with the delivery at your foot door. And it is very difficult under these circumstances. We actually advocate to order online, and we advocate several different families, several different communities to have or form one order together to guarantee the supplements of the daily necessities for one community. So what I want to update you here is that we have enough supplements, no matter from the commercial companies or the local government's storage in our warehouse. It is enough. And we also being backed by a stronger national reserve. And we have also a very smooth supplement channels. And the strategy in Wuhan means that we cannot spread the disease outside of the Wuhan, but I think the goal is under the very smooth supplements channels. And I think for the Hubei province, we are working together with several different brother provinces, and under the leadership of the CPC Central Committees, we have built up 5 different transitional stations alongside in Wuhan. That is to say, all the goods which were transferred to Wuhan without direct contaction, it is going to be delivered through the logistics company in Wuhan. And the logistics company is going to deliver the goods with no single contact with the external drivers. So the drivers who are coming to Wuhan don't need to go through the quarantine time, since they are not getting in touch with the drivers and delivery guys from Wuhan. Thirdly, the logistic and supplements in Wuhan is improving gradually across the province. There are over 3,500 different supermarkets. It is operating underway, and in Wuhan City, there are several different supermarket chains featuring the Zhongbai, Zhongshan, and Walmart. They are facing the new demands, and they have also shifted the way that they supply to the consumers, and they are also going to proceed their order through the online platform. Alibaba, JD.com, and Meituan.com is going to supply the clients with their online platform. All the personnel we needed, and all the delivery guys is actually come back to their working post. That is to say, with more people coming into Wuhan, the logistic company is restoring their delivery capacity. So with all of it, I think the general supplements about the daily goods might encounter some of the difficulties in the short term or some of the structural shortage. But we have the confidence that with the rapid response system and rapid adjustment system, we are going to guarantee the orderly supplement about the markets, and the speed is going to be improved quite dramatically. We are very confident that all the inconvenience is going to be reduced as much as possible. At the very early days about the outbreak, some of the daily necessities is seeing the price grow dramatically. We have done a better monitoring work about the price, and we have also conducted several different monitoring activities in the markets. Up to today, for the major 49 different categories about the food, its price has been stabilized, and the price for some of the frozen porks, among other different production, has improved quite dramatically. There are some of the people actually warming up the price in this critical period, and we have got some of the feedback from the general public, and we have responded quite dramatically, and we are trying our best to meet up with the market demand to place the market in an orderly fashion. And we have also held several different meetings in the province level and in the municipal level. This is going to help us to be getting used with this lockdown in different communities, with a network covering the whole city and the whole province. We think that the mayor, he himself, is going to be responsible for the basket for the vegetables, and we are going to guarantee the supplements about the quantities of the vegetables, and we are also going to focus on the qualities about the daily supplements. Secondly, we also want to strengthen the connections between all the different supermarkets and the communities, and also their connections with the logistic companies. We are also trying our best to optimize the delivery process. And in the community, all the CPC central members is going down to the community, and they are trying their best to strengthen the connection between the community and also the delivery company. And we also pay special attention to those who cannot use the smartphones, the elderly guys, and we have also teach them about how to use the smartphones and help them to order the daily necessities. This is going to help us to address the shortage between the demand and supply. To tackle this challenge, we also have a coordination system, the CPC monitoring system, and also the Hubei province has sending out a special working team to work every night to think about and brainstorm all the questions which existed every day. And every night we have also talked about how do we tackle with these challenges, and we have come up with several different solutions. This mechanism is going to guarantee us, for this special period of time, the supplements about the qualities, with the support across the country and with the care from the CPC Central Committee. We are confident to guarantee very good supplements in the daily necessities and the medical materials and medical devices. And this is going to help us win this battle against the coronavirus. And we believe that with the leadership of the CPC Central Committee and with the effort from the provincial government, we are going to do a good job. Thank you very much. Thank you very much, Governor Cao. Right now, the floor is given to the media. Please identify yourself before the questions. With People's Daily. We have noticed that the provincial government has printed and published a series of guidelines about the production shift of several different companies. So are there any support to these companies? We direct this question to Mr. Cao. Thank you very much for your question. I have mentioned about the supplements, about the medical materials and medical devices is still at a critical point. Although there are huge improvements and a great ease, we are still at a quite critical stage. To tackle this new scenario and to enlarge the self-production, the self-production in the province is the ultimate measures that we are adopting right now. That is the reason why we are launching a campaign towards 3 different categories about the companies to enlarge the production and supplements in the medical materials and also the medical devices. For the 3 companies, but the first category is that we are promoting and helping the companies with their capacity to enlarge their production capacity. That is the first category. The second category comes as several companies who can transfer their business directions. First, several different relevant industries, for example, a clothing and textile company, with their capacity to, they have the capacity to do the general protective suits, and after they are meeting up with several different requirements from the bureaus of quality, while providing them with a fast track, we are going to help them to transfer their business directions. And for some of the companies who are focusing on the general medical masks, they can also upgrade their production, their product, to meet up with the current demand, and we encourage them to adopt the new business direction. And thirdly, some of the companies, they are willing to invest at this critical period and build up new factories. We help them all through this support towards the 3 different categories of the companies. We are going to enlarge the production capacity in the province, and this is going to help us ease this tense between the supply and demand. I want to add up one thing on top of my introduction. For these medical devices and medical materials, currently the supply is actually at a very lower category. For the medics, the doctors and nurses, when they are entered into the ICU, because of the protective suits and N95 medical masks is being shortened at a very minimum supply. So for the medics, they actually try their best to drink less water, to wear less and less protective suits, and sometimes they even wear diapers to avoid the one-time waste about the protective suits and to enlarge the supplements. I think that we can work at this forefront, and we could be better than this. And we also want to reduce the working hours for the medical workers who are fighting at the front line. To do this, in the province, we actually came up with several different policies. And we give a lot of the subsidies to the companies to let them to throw themselves in the production of the protective suits. Thank you. With CMG, currently we are conducting a series of the lockdown in the different communities. That is to say, more and more families adopting online procurement and online purchase. How did we activate the online shopping platform to help the different families? Thank you very much for your question. Since the outbreak of the coronavirus, the e-commerce platform in Hubei has overcome the shortage of the supplements and shortage of manpower, and they have contributed a lot to the day-to-day necessity supplements about different families. And up to today, in the 26th, and we have transferred around 1,157 tons of the daily necessities to every household. And we have, for the provincial government, we have upheld meetings with the e-commerce platform and to better let them play the rules after the lockdown of different communities. We have conducted several works to let the e-commerce platform to do a better job. We have included them into a bunch of lists that we are going to provide the fast track and all the other subsidies too. And for the Wuhan municipal governments, we have notified that all the necessities is going to be transferred to the e-commerce platform at its priority. And for the Wuhan municipal government, we have transferred several different public used buses to be helping the e-commerce platforms. And we are also working together with Shunfeng and to help with all of the e-commerce platform. And fourthly, for the shortage of manpower, we have came up with the working plans for the e-commerce platforms of a series of subsidies for those of the workers who come back to Wuhan. And this is going to enable all the e-commerce platform to better play their role. With CMG and CCTV, many cities conducted a lot of the transportation restrictions, and some of the citizens claimed that their CPI is growing and the consumer price is also growing. How do we address it? Thank you very much for your question. With the progress about the coronavirus outbreak, the Provincial Health Commission decided to adopt a stricter rules and measures to block the origins of the disease, and we are adopting a series of the lockdown management for the communities. The target for it is to block the infectious routes and trying to eliminate the gatherings about the residents. This is a very huge challenge facing in front of us, especially in terms of the supplies about the daily necessities. Even if everybody is staying at their home, they need to drink and they need to eat. And they need to be adapted to the supplements about their daily necessities to guarantee that everybody is going to stay at their home safely, and to guarantee the lockdown about the community level works. we have adopted several measures as follows. From the market supply, we are trying our best to enlarge the supplements. The storage and inventory is enough, and the logistic track is also quite smooth. Although the population in Wuhan is quite huge, but I think there is not going to be any problems in terms of the goods delivery and also the supplements and inventories. And under the support of the Hubei Provincial government, we have been signing up together with 8 different brother provinces with the support from across the country. And since across the country, all the other provinces are sending all kinds of the daily necessities to Hubei, we have procured a lot of the daily necessities. And secondly, we also want to guarantee a smooth internal logistic and transportation. As Director Qin has mentioned, the logistic companies, supermarket chains, no matter domestic or privately operated, their functions should be in full play, with the government providing all kinds of the support. We give them the vehicles, give them the manpower, and we help them to be connected with several different communities and several different residential areas. And we also want to let the comrades to fully play their role. And this is also going to have a quite smooth intercity and intracity supplements and intracity logistics. And we also have the last mile goods delivery. And for that part, we are actually fully play the roles about the e-commerce platforms. The vehicles that they needed and the personnel and the manpower they needed is put forward with us adopting their demand. Supermarkets and shopping malls has changed the way of operation, and they have divided a bulk of the communities into small packages about the communities, small packages about the product to be delivered at the front door of the community. And once the order is made and once the goods is being delivered, everybody will get a phone call to pick up all of their goods. And for the disabled people and for those elderly people who cannot be able to use the application to order online, we are also trying our best to improve our services. And we are also trying our best to cover all of them. The third part is about the lockdown management at the community level. We are working very hard to change the supplying models about the shopping. We advocate online shopping, online ordering, fixed delivery, and we have set up the directors and the responsible person for certain building, and this responsible person will be the person who is going to deliver the goods to the different residents. So the way of shopping and the way of the logistic is being upgraded. Fourthly, we are trying to activate and promote all the powers across the society to work as our comrades to help the community level residents. to work better with the supermarkets and to connect the distance between the supermarkets and the residents. And we are trying our best to supplying all the households in Wuhan. And we also set up different hotlines to address the problems coming from the elderly people and other different disabled people who cannot deal with their current scenario. The prevention and control did and do created a lot of the requirements and difficulties for the residents in Wuhan. And I think with a quick response system and a quick adaptation system with a better adjustment, the inconvenience is going to reduce, and we are also going to go through this period of time as quickly as possible. With legal daily across the province, currently we are adopting all the transportation restrictions, and for the communities, they have also adopted a series of the lockdowns. So the question is about the fluctuations about the price in the daily necessity markets. We direct this question to Mayor Zhou. Thank you very much for your question. For the past 1 month, under the general guidelines and the general arrangement from the provincial government, the price is stabilized, generally speaking, with several different categories about the food growing in a very minimum range. And we have gathered all the information about the fluctuation price and about the market price. And we have adopted a lot of the measures to tackle with all of these problems. In the 23rd, about the January, Wuhan actually adopted the measures of the lockdowns for several different families and residents who were planned to go to tourism spots and who are about to tour into the other different countries. And they did not prepare for this lockdown, and they actually went to the supermarkets to buy the food to help them go through the new year. At that time, the price has grown substantially. In the morning about the 23rd of January, the Market Bureau has talked to several different supermarket chains and remind them to restrain and retain their market price to the normal level. And we also ask them to guarantee us that the price is not going to go dramatically if there's any misbehavior. And we are also going to cancel their certifications to supply in the market. And I think all the suppliers to the Wuhan market has restored the price into their normal level. Secondly, we came up with guidelines to guide all the market price across the province. Thirdly, we have give a very strict service in the markets. For the past 1 month, we have received 347 different cases reporting about the dramatic price rise. And all the marketing bureaus across the province, in the past 1 month, we have adopted a 24/7 working mechanisms at the platforms of the 12315. And currently, we have received over 22,000 different phone calls asking the questions about the price in the market, and we have given them a response in a timely manner. Fifth, we have helped several different restaurants to return the orders for the patients who for the residents who ordered for their New Year's Eve dinner. So from Hubei Daily. Recently, we heard that there is a shortage for the formula pounders for the babies and infants. So my question is about how will the Hubei Provincial government guarantee a smooth supply about the formula pounders? Thank you very much for your question. The formula pounder is a very unique product, although it is a very niche market, and I think this kind of product cannot be replaced by other different pounders at the same categories. Currently, the storage about the formula pounders is stored at 1,600 different tons. It will guarantee all the babies to consume these formula pounders for over 1 month. 70% about the market in the formula pounders is being supplied through the direct stores, while the other 30% is being supplied through the supermarkets. Because of the outbreak of the coronavirus, all the direct stores did not open up. And since we are finding these problems, the provincial government has talked to the direct supplying stores, and we have transferred the sales method from the direct selling stores to the supermarket-based selling problems. The demand for the formulas has been eased, and for going forward, we are also going to monitor this special product to guarantee the continuous supply about this product. From China Daily. Recently, the medical protective suits and N95 medical mask is increased dramatically. This means a easing about the supplements. We direct this question to Mr. Wang. Thank you very much for your question. In the recent few days, the medical protective suits, as you mentioned, is increased dramatically. That is to say, across the province at different cities and counties, the supplements about the daily material, the medical materials is increased dramatically. Yesterday, I actually go to a clinic at a township, and I also went to a hospital at a county, and I also went to a healthcare center in a city. And from my field survey in the 3 different areas, the township clinics and also the countryside hospital and also the city-side hospital, all the medical materials and medical devices can be lasted for 2 days, 3 days, and 1 week. That indicates all the supplements is improved gradually. This is being benefited from the supplements and support from the CPC Central Committee, and this is also because of the support and help from other different brotherly provinces, and also the kind-hearted donations from all walks of life, from all across the society. And however, we should say that the medical material is still facing a huge gap between the supply and demand, and we can view this gap from 2 sides. From the general numbers of the demand, every day at 8 a.m., we disclose the distribution number And the demand is always in a very short and in a very urgent scenario. The delivery is actually goes into several different hospitals. And we actually guarantee the ICUs and also the special spot positions and also the cabin mobile hospitals. And that is how we are going to say to guarantee the front line, guarantee the urgent demand, and guarantee the medical workers who are working at the forefront. The demand itself is only demand for the medical rescue work, and it only lasted for 2 to 1 week. This did not include it from the protection in the society. For example, for the community workers, they also face a huge shortage in the supplements about the medical equipments. From the structure perspective, currently, the demand structure compared with 1 week ago and also 2 weeks ago, the structure has been shifted greatly. For the protective suits, as mentioned by Governor Cao, we are still in huge shortage. For the quarantining suits during the operations and protective giggles, and they are also under a huge shortage. From the medical equipment, including the negative pressure helmet and also the ventilation machines, the oxygen supplying machines, especially those of the equipment working in the rescuing process for the severe patients. This is also under a severe shortage. Of course, we talk about the quarantine at the community level. The protective kits and also the medical masks and also the temperature testing equipment is also in a shortage. Generally speaking, the gap between the supply and demand still existed. We all know that to win the battle against the coronavirus, the logistic supply is one of the major pillars. And we also want to thank the CPC Central Party and the general public for your trust. And we will prioritize the people's life. And we are also going to use the coronavirus outbreak as a mirror to reflect our shortcomings. And we are also going to use the work that we have done in the provincials about the coronavirus as the measurement to our day-to-day work. And we are also going to improve these supplies, and we are also asking for more donations from across the societies. We are also trying our best to increase the productions from all walks of life to gather more medical equipment. And we are also going to enhance the coordination and management and best deliveries for the medical protective suits, medical materials, and medical devices. We are also going to coordinate the supplements of the medical devices. And for the key areas, we are also going to prioritize the medical equipment supplements at the key areas. This is going to help us to win the battle against the coronavirus. with Hubei Broadcasting Company. There is a lot of the logistic companies reflecting that there are shortage about the manpower. How do we address the problems for all of these companies, and how do we help these logistic companies to guarantee a normal day-to-day life for the general public? This is a very professional question and a very precise question. The lack of manpower and lack of personnel is one of the major headaches for us to guarantee the logistic work. And according to the general statistics in Wuhan province, currently the gap in the logistic supplying company is reaching around 10,000 people, among which there are lackage of the 4,000 people working at the supermarket. And we are also lacking around 2,000 delivery men, and on the e-commerce platform, we are also lacking around 4,000 workers. And we have came up with provincial plans to help all the workers who are spending their New Year festival to come back to Wuhan. And currently, the lackage of manpower has greatly influenced the supplements in the markets. We are adopting several different measures to address the problems. And we have arranged all the buses across the province to be managed in the community level and in the district level. That is going to help the delivery person to connect the supermarkets with the residential areas. And also in the Hubei provincial government, we have arranged several different vehicles to be focusing on the deliveries to the old residential area. We have also coordinated all the delivery industry. For example, we have collaborating with Shunfeng Group, and they gave us their extra manpower to be arranged in the Wuhan municipal government. And fourthly, we have worked on other different personnel and other different organizations in the society to help us to address with the logistic problems. With all of this help, all the Wuhan province is going to ease their pressures in the goods deliveries and goods logistics. In the short period of time, we are going to guarantee this 10,000 people can get back to Wuhan. And we are also going to activate more vehicles to be worked in the delivery process. Thank you very much. So with Yangtze River Daily. So how do we guarantee the demand for the general public to buy any drugs or from the pharmacy stores? For the consumers, if their demand for the pharmacies and their demand for the medicines is one important part during the outbreak about the coronavirus, we have came up with several different plans. And under the normal circumstances, many different consumers is using their pharmacy is actually come to the pharmacies and buy several different medicines. And during the outbreak about the coronavirus, after we locked down the city of Wuhan, the bureaus of the marketing has sent several dozens of teams to check to all the different pharmacy and also the medical stores in all the different residential areas. Not much of them open the doors, and it is very difficult for the residents to buy the medicines from the pharmacy. So according to the requirement from the provincial government and also according to the requirement from the municipal government, we have talked to the headquarters, talked to the giant who are pharmacy giants, and we have required them to open their door. And we have also talked to different pharmacy owners. And we call them, send them messages to ask them to open their pharmacy once again. We have also witnessed that for many different pharmacies, they only open a small window and they deliver all the drugs through a channel. So we can see that the pharmacies is adopting a series of the no-contact delivery mechanisms. And secondly, we have also extended the market supplying method. The bureaus of the marketing has been talking to several different supplying companies, including the national pharmacy groups and the Jiuzhou groups in the pharmaceutical industry, to fully play their roles at several different parts about the pharmaceutical industry. And we have adopted several different measures. For example, to book the medicines online, and the medicines is going to be delivered at the forefront at your residential area. So in the past, the pharmacies have opened up their doors, and currently, without opening their doors, the pharmacy can still service the residents. And thirdly, we have also improved the supplements about the pharmacies, and we have also adopting a series of measures to control the price of the medicine. Thank you very much for your concerns about the work in our bureau, and thank you very much for your support. Final question. With Jinchu Daily. Currently, in Wuhan province and other different cities, in Wuhan city and also other different cities, most of the mobile cabin hospital came into use. How do we guarantee the medical supplements into these hospitals? Thank you very much for your question. With the guidance about the central government's monitoring team and with the support from all of them to Wuhan city, and every day the logistics supplying group from the CPC Central Committee is holding 2 meetings with the Wuhan municipal government to discuss about the distribution, supplements, and logistics about the medical materials and medical supplements. And we are trying to use all of the methods to arrange the medical materials. And this is going to help us to address all the problems in the productions, in the distribution, and in the delivery process. And this is going to help all the hospitals in Wuhan, including the mobile cabin hospital. And for all the brotherly province and from all walks of life, they have donated us a lot of the medical materials and medical devices. We are quite gratitude towards the support from the CPC central government, and we are very thankful for the heartfelt donations from the brotherly provinces, and we are quite aware about the kind heart from the donations from all walks of life. And we all know that the mobile cabin hospital is playing a vital role in guaranteeing the treatment of the patients. And currently, there is a huge demand from the mobile cabin hospital. According to the general statistics we have done so far, every day the mobile cabin hospital needs over 10,000 protective suits, over 22,000 units of the N95 medical masks. They also need a bunch of the CT equipment and ventilation machines to guarantee the construction and the maintenance about the mobile cabin hospital, we are trying our best to gather all the medical equipments. Currently, in Wuhan province, all the CT equipments and also the ECG equipment in the Wuhan municipality is being fully equipped. And for other different mobile cabin hospitals, the provincial government has arranged several different medical equipments, and we think that their demand is also being guaranteed. You have asked about several different measures that we have taken up to meet the demand. The measures is being divided into 3 parts. First, we have categorized different responsibilities. We encourage local government's management. We also want to encourage the local governments to try all the efforts to meet up with the demand from their local mobile cabin hospitals. On top of this, the provincial government is precisely adjust and precisely arrange all the medical equipments and to be supplying those of the hospitals who are in the huge shortage. The second part is that we have formulated several different standards. Without standards, there is no work done. So after we follow up the standards which was being formulated by the NCP, and also we have fully supplement and fully carry out all these standards. We have made sure that every step has a standard to follow. Thirdly, we have optimized the supplying process. We guarantee the system, guarantee the supply, and we have follow-up efforts to the different mobile cabin hospitals across the province. We have given several different special medical material supplies to the mobile cabin hospitals, and we also want to improve the mobile cabin hospitals to improve their treatment and rescue ratios. We are very confident to the logistic supplies to the mobile cabin hospital. Thank you very much for you attending this press conference. With that, we